A stroke, sometimes called a brain attack, occurs when something blocks blood supply to part of the brain or when a blood vessel in the brain bursts. In either case, part of the brain becomes damaged or die. The effect of stroke varies from person to person based on the type, severity, location, and number of stroke. The brain is very complex. Each area of the brain is responsible for a specific function or ability. When an area of the brain is damaged from a stroke, the loss of normal function of part of the brain may occur. This may result in disability. The brain is divided into three main areas, which are cerebellum, and brainstem. Depending on which of these regions of the brain the stroke occurs, the effects may be very different. Ischemic stroke. Ischemic stroke is the more common type. An artery in your brain narrow or become completely blocked. The blockage may be caused by blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supply to become ischemic. Similarly, the blockage may be due to an embolus, the blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrow artery and obstructs blood flow. Then we have hemorrhagic stroke. Hemorrhagic stroke is due to bleeding into the brain by the rupture of the blood vessels, which cause damage to the part of the brain. What effects can be seen with a stroke in the cerebellum? The cerebellum is the part of the brain that occupies the top and front portion of the skull. It controls movement and sensation, speech, thinking, reasoning, memory, vision, and emotion. The cerebellum is divided into right and left side. Depending on the area and side of cerebellum affected by the stroke, any or all of these functions may be impaired. Movement, speech and language, eating and swallowing, vision, cognitive, emotional control, bowel and bladder control, sexual ability. Effect of right side stroke in the cerebrum. The effect of right side stroke may include left side weaknesses or paralysis and sensory impairment. Visual problems, including an inability to see the left visual field of each eye, the inability to localize or recognize body parts, memory problems, behavioral changes such as lack of concern about situation and depression, special problem with deep perception or direction such as up or down and front or back, inability to understand map and find objects such as clothing or toiletry items. Effect of left side stroke in cerebrum. The effect of left side stroke may include right side weaknesses or paralysis and sensory impairment, problem with speech and understanding language, visual problem including the inability to see the right visual field of each eye, impaired ability to read, write, and learn new information, memory problems, behavioral changes such as depression and consciousness, impaired ability to do math or to organize reason. What effect can be seen with a stroke in the cerebellum? The cerebellum is located behind the cerebrum toward the back of the skull. It receives sensory information from the body through the spinal cord. It helps coordinate muscle action and control hand movement, coordination and balance, posture and maintain our structure. So cerebellum is the reason that you can stand on one leg, jump around and wrong. Although strokes are less common in the cerebellum area, the effect can be severe. The most common effect of stroke in the cerebellum included inability to walk and problem with coordination and balance, dizziness, headache, nausea and vomiting. What effect can be seen with a stroke in the brainstem? The brainstem is located at the base of the brain, right above the spinal cord. Many of the body's vital life support functions, such as heartbeat, blood pressure, and breathing, are controlled by the brainstem. It also helps control the main nerves involved with eye movement, hearing, speech, chewing and swallowing. Some common effects of stroke in the brainstem include problems with breathing and heart function, body temperature control, balance and coordination, weakness or paralysis, chewing, swallowing and speaking, vision, coma. Unfortunately, death is possible with brainstem stroke.